Hi, everyone. It's nice to kind of join you guys and get to talk about this a little bit. I was just joking. It's nice to talk to somebody who's not just a bunch of other PTs for once, and be able to kind of get a little bit of some different perspective and kind of talk through what we do in the hospital to begin with and how we can make it a lot more fun with use of gaming, which is up y'all's alley. So I hope this is helpful for you guys and helpful to, if you're not already having that relationship with the therapist at your hospital, to kind of start that process and work your way into that aspect too. And it kind of how Andrew was talking about at the tail end of that last session, that there's a lot of different uses for gaming. And while we all just want to sit down and play video games and have fun sometimes, we can also use them as a great tool to be able to reach a lot of other goals while the kid's in the hospital and just make all of that more fun.
Yeah, Logan, I'll let you take it away of so what exactly is physical and occupational therapy?
Yeah, so that's a huge umbrella of things. So I'm going to speak specifically to the hospital, because that's what our primary focus is today, right? So in the hospital, from a physical therapy perspective, we can have a lot of different goals depending on whatever the patient is there for. Generally, physical therapy is going to be focused on things like functional mobility, cardiopulmonary endurance, some neuromuscular reeducation if there's been some kind of neurological injury or neurological impairment. And occupational therapy can sometimes incorporate more of a cognitive therapy component. So processing some vision skills if there's been a visual impairment, working on tracking, visual fixation, that sort of thing. But also a lot of fine motor skills and activities of daily living as well. So making sure that people can bathe, dress, groom, toilet, all of those things that we have to do on a daily basis to make it through our day and be functional. And that's what our job is in the hospital, is whatever reason that the kid's there for, whether it's a surgery or an injury or some kind of critical illness. When they're here, a lot of times they're not moving around as much. They've been intubated, they've had a big surgery, something like that, and they've lost some ground in those areas. And it's our job to try to get them back closer to where they were so they can be functional at home and continue to progress once they get out of here.
So that kind of goes into what are therapeutic goals that generally Logan and I will work together to get to kind of focus on. So we're increasing our mobility. We'll have a patient that needs to kind of stretch out and do some reaching. That's kind of been their weakness. We're improving how much their endurance of how much they actually want to do an activity. Generally, our sessions run 30 minutes together, but we got patients that like to sit out after 5, and so kind of get that endurance there. The hospitals, there's a lot of laying down, lots of sleeping, and lots of sedentary doing nothing. And we can give games that make us get up, move around, and yeah, and we want the kids to go home as in the best shape that they could possibly go home in. So, we've had some issues with this in our practice runs. Are people seeing a black screen or a kiddo in a virtual reality headset? Kiddo, awesome, sweet. We see kiddo. So I'm gonna play this video. This is a one of our patients with Logan in the background, kind of as support, playing a game you've probably all seen called Beat Saber. So I'll let the video speak for itself. This is Logan's favorite song, and you'll see why. So Logan, what are some of the things you're looking for while our patient's playing?
So for this particular patient, just to give you guys a little bit of a background, he has had a previous heart transplant, but is currently in transplant organ rejection. So he's waiting on another transplant of that heart, and he also needs a kidney transplant. You can see he's got an ostomy bag. He's had a really big GI surgery where there was some injury there. So he's a kid that's been in the hospital for months and months and months at this point, and there's been some depression aspects going on. He doesn't have a lot of intrinsic motivation to get up and just do exercises on his own. He doesn't like to get out of the room and take walks because he doesn't like how big his belly is, and he doesn't want other people to see him like that. So he spends most of his day in his room. And so what I'm trying to get him to do is to get up out of bed and to do some hard work. And he loves video games. So for him, I'm trying to focus on like a lot of that upper extremity reaching, and a lot of it is he has a lot of hip weakness. So trying to get him to do squats is really, really difficult. But all of a sudden, when you strap that VR headset on and he's got to dodge those blocks as they're coming in at him, he drops it low. And I love it every time. And that's why this song is my favorite, because there is a lot of really good like repetitive squatting action built into this song. And that's been a fun thing working with Andrew over the last 2 years or so, like just learning those nuances to the games of which ones can I really get uh, my goals out of, and I can sneak it in. And like I think when we were doing this particular session, he picked probably 2 or 3 songs, and I told him he could pick whatever songs he wanted as long as this was the last song that we did.
Before we go on to the next to Lou's question, this was like maybe our fifth or sixth session over his we generally do a session with him like once every 2 weeks, um, just to kind of space them out. So yeah, this is like about our fifth or sixth session at this point.
Yeah, and he's a kid that's played a lot of video games anyway. I don't know if he specifically has a VR set, like access to a VR set at home, but he had played Beat Saber before. I think even we brought it into him. Like he knew exactly what to do, how to play the game, and he had favorite songs on it already.
If you're looking at the video, he's playing Grand Theft Auto in the background, so literally pausing that to play with us, and then going back to it right after. To kind of go to the next slide, so virtual reality isn't quite the only system we use. We use a lot of augmented reality. This patient's playing a game called Arise by Spellbound AR, which is an iOS game, which we had developed with Spellbound to get patients to move around the unit. So on all of our units, we have basically little portholes that have fish, treasure chests, little aquatic themes that the patient can point their cameras at, and then activities happen in their game. So it gives them, encourages them to get up and moving around their units and kind of explore the units as they can. And they also get a packet for them to take home with them to encourage movement at home.
And this is one for our hospital specifically. I think probably my favorite floor that we use this on is our oncology floor. A lot of times those kids are here for longer extended admissions, and it's hard to get them to get up and just move during the day. So this is something that helps just encourage them to get out into the hallway, to take some walks, and just so they're not cooped up in their room all day long.
To answer Marty's question, that is our iPad, but we very much encourage patients to use their own devices. There's like a longitudinal game attached to all of this, which it encourages you to go visit these different spots and remember where these spots at and find them. To it's kind of like an Animal Crossing, like where you're building up your little home base and you're collecting coins and materials from these activities. The app is free, but the stickers are not. email JJ about the specifics on this one. So kind of go to their next area where we'll talk about like how we use like kind of standing and playing. This is a very similar system to one of our previous patients. So we've got our patient with another one of our PTs playing a game called Eagle Flight on the PlayStation VR. So this patient, one of their therapeutic goals wasn't as much moving around as much as like balance. So they're playing a game that really challenges your balance, where you're moving around, and you have to your body has to kind of remember where it is in space while your eyes are getting a bunch of conflicting information. So yeah, it's been
Yes.
a
So from the balance aspect, our bodies use three systems for balance, and we use vision, sensation, and then like our inner ear vestibular system. So the VR takes away that accurate visual input. And then for a lot of our patients in different populations, specifically in any oncology population, they'll have some peripheral neuropathies, so they don't have a um, accurate sensation to go off of either. So we really tax the vestibular system with the use of VR. And this, even just having him standing while doing it, was difficult for this particular patient because his endurance was tasked. Oh, excuse me. Um, his endurance was impaired pretty significantly at this point in his hospitalization. So just having him stand up, and then the additional difficulty of that standing balance without the accurate visual input, ended up being a really difficult task for him to do, even though he's just standing there playing a video game.
but still greatly beneficial to his therapeutics. Talking more about standing and playing, I've got a patient here that I was asked, hey, could you encourage him to do some standing and playing? One of the things that he really didn't want to do was use his walker. So he comes out of post-surgery. They don't want him walking yet because he's got an abdominal incision. And so while we're doing that, we're going to work on the Nintendo Labo. So he's using stuff with his hands. He's building the motorcycle Labo kit from a multi-day process. So it's giving him like we've got a goal that we're working towards. And when we did his goal. This was kind of actually independent of the walking portion, but the nurses were saying that he doesn't really want to use his walker. So what we did is we attached that Labo set to his walker. So now he's not using a walker, he's using his motorcycle. So the patient doesn't want to walk their walker, but they want to ride their motorcycle. So we're riding them. They're riding their motorcycle around the hall. So this is a patient who's like working on their walking skills, but once again, they're not walking their walker. They're riding their motorcycle. They're very specific about this.
And I want to draw everyone's attention to the smile on his face while he's doing it. A lot of times in the hospital, PT, OT therapies are not the highlight of their hospital stay. We ask kids to do really, really difficult things, and we recognize that it's not always fun. We try our best to make it fun. But sometimes when it gets down to it, it's painful and it's difficult, and things that people don't want to do other than because they have to. And now with something as simple as just attaching this Labo onto his walker, all of a sudden he's having fun with it when he was refusing to use it prior to this.
Mm-hmm. That goes back to kind of our previous talk where Garrett had that example of the patient that didn't want to use the two buttons for speech. But we switched it to, instead of it's not for speech anymore, it's for Mario Kart. We want to use the buttons now. The buttons are great. And kind of flip the script a little bit, that it's now it's something they want to do. We're really tricking them into doing the thing that we want to do. Because one of the things I like to talk about, especially when we go back to Beat Saber, is may not have counted how many reps of swinging their arms that the patient did, but it was, I mean, if you look at the end of a Beat Saber song, there's 500 notes that you have to hit. So that's at least 500 reps of swinging your arms. And Logan, how hard is it to get your patient to do this 20 times?
I mean, especially that patient, and even like not from the arm aspect, but the squats. I cannot get him to do. I've known him for over a year now, and I cannot get him to just stand up and do a squat unless we're playing the game. And
Mhm.
when we're playing the game, he'll do 5, 6, 7 in a row with no complaining. But outside of the game, he won't do any.
Yeah.
And I think the how you were talking about with the buttons, that gives us really good information from like a medical standpoint, and if we're trying to assess what a patient's cognitive abilities are, a lot of times it's really difficult to parse out, are they not doing something because they're incapable of doing this task, or are they not doing it because they don't want to? So, especially with something like a communication difficulty, if we're trying to get them to use a single button communication and they're not doing it, is it that the button is too difficult? Do they not understand what we're asking them to do? So then if we swap it up into a game and all of a sudden they take off and they're using the buttons, well, they understand what they're supposed to be doing and they have the physical capabilities of pressing that button. Just the task that we were asking them to do was not important to them, so they're not doing it.
Mhm.
Um,
Well,
Marty,
nice.
I'm looking at Marty's question. Do I have a method of tracking non-traditional movements, such as virtual reality, and translating that into PTOT goals, such as like MET scores? I'm not sure I fully understand what you're asking as far as like tracking non-traditional movements. Like as far as like quantifying like the movement that they're doing.
So that I think to kind of that kind of goes actually back to like Dr. Asher Mark's presentation, where we're not using we're not using medical devices. Um, so they don't have tools that medical devices would require, such as a lot of that quantifiable data tracking. Because why would Beat Saber need to have quantifiable metrics of how many squats you did, or how many inches the headset dropped during the squat, what angles things were hit at, um, and there are technology that exists that do some of those, but they're astronomically expensive because they are technology and medical devices. Um, that have been released. So we kind of keep it a fine line of using what is cheap and having a therapist be able to identify this is the therapeutic metrics that I'm looking for, versus a computer that can tell you every therapeutic metric that you could possibly have, but we can't justify that to like for insurance or just on a cost standpoint.
So looking at some of the follow-ups as far as like how I'm charting that they're reaching their goals, or I'm kind of quantifying from a therapeutic perspective um, their activity level. So I'm doing a lot of vitals monitoring and like monitoring work of breathing and that sort of thing, and well, maybe not something as specific as a METS goal, but if I'm watching heart rate increases, blood pressure increases, work of breathing, respiratory rate, that kind of thing, then I can quantify their exertion level. And I'll often use an RPE scale too, a rating of perceived exertion, where they can subjectively tell me how hard they're working. And I'll put all of that information into my note. Um, And a lot of times I'll have goals in the hospital of a patient can tolerate 20 minutes of continual cardiopulmonary activity. So something like, standing up and playing Beat Saber for 20 minutes straight would meet that goal to me, as long as they're working at a hard enough level, either via that RPE scale, and I can be as specific as that in my therapeutic goals of will maintain an RPE of 11 out of 20 for 20 minutes during cardiopulmonary activity, and then just use a video game, a virtual reality, even a scavenger hunt with augmented reality in the hallway to be able to reach that goal.
Right. There are, and I think there's shown bits and pieces of areas that a therapist is required to be in, and parts that a therapist is not required. When we were working with our patient doing augmented reality, the patient's goal was the patient needed to just have uh, regular walks around the unit. A therapist did not need to be there for that, because it doesn't need any of that like specific metrics that are being recorded. Um, Whereas when we were working with the patient doing standing and play using VR, that did need a therapist there, because for safety reasons. I wasn't qualified. I'm not qualified to run that therapeutic session. Um, but also, on the flip side, Logan has the patient to worry about. So we're working together, because I can manage the technology and Logan manages the patient. So Logan doesn't have to worry about, all right, why is the camera being funky? Why is the PlayStation controller being really wobbly on screen? That's stuff for me to worry about, and Logan worries about, all right, is the patient healthy enough for this session? Is their heart rate uh, um, at the right level? Is their blood pressure okay for doing this? Um, what the patient's actual goals are we're working on? All right, can we have a song that is more squat focused, or a song that requires us to do a lot of reaching? Can we have a game that requires lots of balance work, stuff like that? And so um, working on uh, both of our expertises to kind of make that happy medium, which is what the real value of a co-treating session.
I think too, even for the activities that therapy doesn't have to be present for a lot of patients, we'll kind of screen them beforehand, and like I'll let Andrew know of like, hey, he's doing great. I have no concerns about like him being stable enough to do these activities. Can you just have something that he can get out of the room and go do a hunt with? So if you are working with a patient that is seeing PT and OT, even if you're not doing a co-treat with them, um, kind of just touching base, it can help to have that level of communication of, hey, is it okay if I give him a scavenger hunt in the hallway that maybe takes him 20 minutes to do? Because even if a kid's sitting up in bed and they look totally fine, that even that level of exertion, just taking a walk in the hallway, might be too much for them. So if they are being seen regularly by therapy, if there is a therapy consult it can help to just have that communication in place.
Mhm. And it's always a communication, even like outside of the therapeutic space. If you're using VR, that or any game that requires like significant exertion, like that should always be a conversation with the nursing staff or med staff. If this patient is well enough to do that, it should just be in your contraindications that you like identify when you screen a patient for VR. To kind of go on, we do a lot of Legos in our hospital. John, who I know I've seen in here from Build Up Steam, does a ton of Legos with our patients, and Legos are fantastic for hand dexterity. It gives them something to kind of work on outside of a therapeutic environment. Um, and I know, Logan, you can speak to like the specific movements that Legos give that like are so beneficial.
Yeah, so there's Lego are an outstanding fine motor activity, and they're really really fun homework. So as therapists, we're often always giving patients and their families work to do outside of our treatment sessions, because even if we're seeing somebody daily and even if we're seeing them for full hour blocks at a time, they're not going to have that meaningful improvement if the only time they're working on these things is while we're present. So we'll give them things that they need to work on throughout the day, or even like over a few days at a time, to continue to have that improvement. And Legos can just be a really, really fun, fine motor skill. There's a lot of coordination involved. There's a lot of hand strength that's involved. And two, thinking about like the setup of your environment, you can incorporate a lot of different upper extremity range of motion. So, if the pile of pieces that you're starting with are way over on that corner, maybe they have to lean and reach and then come back and do it right in front of them. Or maybe they can stand up while they're doing their Legos. And for a lot of our kids, even standing up long enough to do a Lego set can be a taxing activity for them. But that's the way that they get better. And being distracted with something as fun as Legos can make that a whole lot more realistic to ask them to do, 2 or 3 times a day.
We've talked about like virtual reality, and there's lots of games that are non-VR that are also designed for exercise. I've got a patient here. I've got 2 videos in here of a patient using Ring Fit Adventure. Um, and I know Ring Fit Adventure is one of Logan's games because it also makes you squat. Logan loves games that make you squat.
Squats are my solution for so many in the hospital. And
So
this is one that we just started using together.
mm-hmm.
And I'm really quickly falling in love with this game because there's so many different ways that you can make things really, really difficult. You can like vary the exercises to a point where they're not doing a lot of leg exercises in a row, or you can make them do a lot of leg exercises in a row. And the way that even the ring fit kind of like excuse me, can recalibrate for every patient. So they really have to hold that squeeze for that full time, and it can make it really, really fun for the kids to do pretty difficult things.
Yeah, it's gamifying that exercise portion, and these are like real exercises that they can do on their own. Like this patient can do these exercises on his own. There was no like medical reason that like kind of Logan needed to be there for doing like walking around his room, doing some stretches, stuff like that.
Going by that leg sensor.
And this, so some background behind this patient. So when the possibilities are endless. Like with adaptive gaming, our work, there's no like limit to what we can do. The limit is just our creativity and like the tools that we can find on hand. So one of the things we realized, we were using the Oculus with this patient. Beat Saber doesn't require you to press any buttons to play the game. You do to navigate menus, but not to play this game. So this patient is a double amputee, an arm and a leg amputee. So we literally strapped one of the controllers to one of his residual limbs on his arm, and then he's holding the other controller, and he's slicing with his residual limb and his controller. I'll get this video to play. So he's slicing as it comes. I think he's actually playing Fruit Ninja in this game. So because we have to be real mean, he's not even sitting flat on the mat. He's sitting on a what was it called, Logan?
So he's sitting on a Bozu ball. So it's adding a pretty difficult level of like trunk control and dynamic seated mobility. And you can see him shifting back and forth while he's looking around for his different targets. So he's getting some great shoulder range of motion, which a lot of times after amputations, it's common to get contractures afterwards, and range of motion is really, really important. So this makes it a fun way for him to work on that difficult shoulder range of motion, and he has that difficult dynamic seated balance where he's getting some good trunk activation as well.
In this second video, we did the same thing, except instead of strapping those controllers to his leg, we strapped him to his feet. And if you remember, he's a double amputee. He only has one leg. So we made a second leg out of towels and the remnants of his boot that he had on his right leg. So we took his boot apart and we made a fake leg out of it, and strapped the controller to that because his residual limb wasn't big enough, or it didn't reach out far enough for him to play the game with both legs.
So from a therapy perspective, not only are we getting some good like anti-gravity kicking and working on some strengthening and that kind of thing, but also when we're talking about amputees and looking forward to gait training with a prosthesis, that proprioception of where that prosthetic limb can be really, really difficult because you don't have the sensation that we're used to in our feet when we're walking. So doing a game like this where the sensor is set up really ingeniously of where that left prosthetic foot will eventually be, it gives him some really good proprioceptive input. So he's already starting to learn where that prosthetic foot will be in space, and it's setting him up really nicely for down the line when he starts doing some more difficult gait training.
So I'll get to some of these questions because this is our last slide. So Logan, I'll let you get into like what the actual research behind this is talking about right now.
So this is something that I just wanted to kind of briefly touch on, because if you're starting to implement this relationship in your hospitals, a lot of the therapists will be like, well, why? There has been some really good research with use of different like virtual and augmented realities. Usually, the research that I've found is focused more on neurorehabilitation, particularly in stroke and spinal cord injury. Some vestibular, and that can get kind of iffy in the hospital when they're like really acute concussion. So we have to make sure that we're careful with that aspect, but that can be good from an outpatient down the line. But you can find pretty good research as far as stroke rehab. I think too, when you're reading through it, making sure that a lot of times our medical research will call like the Wii virtual reality, when from a gaming perspective, you might not think of Wii as that. It's a motion controller, right? But a lot of times us medical people, we don't always know what the cool terminology is, and we like to make everything sound fancier than it might be. So we'll call Wii virtual reality because any game that's not just sat with a controller in your hand must be virtual reality. So kind of keeping that broad definition in mind if you are trying to find some of this stuff. And the therapists at your hospital, or a lot of times the hospital systems in themselves, will have really good databases that you can do some research in. And if that's something that you're not comfortable really navigating, of trying to find that good research, I'd be happy to help share. I did put a couple of references at the end of our presentation. But if your therapist at your hospital have any questions about how co-treatments go, or why we're even doing this, I'd be more than happy to discuss with them, or email back and forth, anything like that, because overall it can be a lot of fun. And the other thing on the research aspect, it's really difficult to find good pediatric research just across the board, because research is not done as much in peds as it is in adults. So most of this research that I'm bringing up is in the adult population, but kids have these problems too. Kids have spinal cord injuries, kids get strokes. So a lot of the research is, while maybe not one for one identical, it'll translate without issue, it's definitely related, and you can make some of those stretches and justify it pretty well.
Yeah. So, now we just open up for questions. I know there's a few. Do you supply your PT/OT with this equipment, or do they have to go to you every time you have a patient that wants to play games for therapy? In other words, do you always co-treat, or can you give therapists the tools to do this themselves? How often are you there with PT/OT? So, asking PT/OT to kind of use some of these video games themselves. So managing the patient and utilizing games that are not always the most intuitive to set up. VR is great, but I don't think anyone can say that VR is easy to use, um, which kind of requires us to kind of uh, have that two-person team of one person manages the technology and any issues that might arise, and the other person can put their whole undivided attention on the patient. So my expertise is I know what games do what. I know how the games can help with certain therapeutic goals. If we have a patient that wants to squat, I can make that recommendation to the therapist of like, this game is very squat heavy. This game is very balance heavy. This game does this game does that. And they can utilize that knowledge for their own recommendations. I'm kind of very specific because I am not the physical therapist. So the medical advice for the therapy is not coming from me. I'm just informing the therapist that this is how the tool works, and so the therapist can make the medical determination.
I think too, speaking from the therapy standpoint, it would be like I'm a nerd and I like technology and I play a lot of video games on my own time. Um, but even for me, it would be difficult to get the equipment in the room or in the therapy gym, set it up while having the patient there and getting the patient ready at the same time. And then if something was going, off, if I had a controller issue or something like that, to be able to keep like an appropriate eye on the patient and monitoring them while trying to go through and troubleshoot whatever's going on with the technology too. So I think in most cases in the hospital it is a two-person job if your goals are these therapy specific goals. And even for a lot of the patients that me and Andrew will co-treat with, um, he'll go back at other times not with me and just do a more traditional gaming session where the focus is fun and not on these like more difficult therapy goals.
Hmm. Marty asked what headset we were using. I assume you're talking about this patient. We use the Rift one. This video was taken roughly 3-ish years ago. So I don't think the Rift 2 was even out when this video was taken. Let's kind of scroll back up to see if there's any questions. How does recreational therapists fit into this therapy model? Seems like they're not involved. Sadly, we do not have a hugely robust rec therapy team in our hospital. The rec therapists that we do have manage a lot of our activity rooms, and they are also more primarily the other rec therapists we have are in adult world, and we used to do more in adult world when we were helping set up the adult occupational computer therapy lab. So, but we do not work very often with our rec therapists. So I wish I could have a better answer for you for that one. Do you see an increased request/demand for co-treatments between departments and professions following and implementing VR sessions? I have gotten a bunch of we will occasionally have like a doctor walk into kind of our VR sessions and like be like, whoa, this is the coolest thing in the world. And that kind of sprung a relationship that I have with our attending for our rehab unit, which so she can give me referrals of patients that might need might be interested in doing PT sessions or be very might be open to doing some adaptive gaming and whatnot.
Yeah, I think we've been able to kind of showcase what we can do a little bit, and we've had a lot of like really positive interaction with it. Like there's whenever the patient's nurse sees us come in for a co-treatment, it's like, oh wow, like that's really cool, I haven't seen that before. um And I've been trying to kind of advocate for a lot of the other therapists to use some of this technology. Um, so I think it helps to have kind of like that point person within your therapy department. Maybe find the biggest nerd there, and it's like somebody who is already into video games, to try to help like bridge that gap and start that relationship, just to get the word out to the other therapists. Because a lot of times, if they're not used to playing video games and they don't know a lot of, like, they might just be uncomfortable with the aspect of that being involved in their session, because it does relinquish some control as a therapist. Um, but bringing, I think trying to have that point person and then kind of branching out from there and trying to get more and more involvement would be the way to go.
So Lou asks, how do you manage cleaning headsets for struggling with our infection control? The PlayStation VR is fully vinyl, plastic and vinyl, and passes our infection control. Our infection control hasn't said that it doesn't pass our infection control guidelines. I think it's one of those things that, like, we know it's got no cloth on it, so we're not going to ask infection control about whether it passes very minutely. That being said, the Rift 1 on here, we know doesn't pass infection control, and so we no longer use the Rift 1. Because it does have a lot of cloth components. Yeah, we are waiting with bated breath for Dr. Marks's data to send to our infection control team using the clean box, because I know our infection control team will be very interested to see that.
Well, Andrew and Logan, that was a great session, and I know that co-treatment is such an important part of this work that is done across the country, and you guys seem to be doing an amazing job with it. And infection control is yet another topic I'm sure we could fill a whole session with, for sure.
We fill a whole symposium on infection control, to be honest.
I know, for just about everything around the hospital. Before we wrap up our day, any last minute words for everyone across the world listening right now?
Oh, I'll just say that if anybody has any more questions on like PT in general, or trying to implement some of this gaming stuff with your therapy departments, or trying to build that relationship, I'd be more than happy to be of assistance in any way I can. If your therapists are hesitant and they want to talk to a therapist that's been doing it for a little bit, I'd love, feel free to pass along my contact information. I can throw my email in the chat if you guys don't already have it. But I'd love to help other people be able to do this too, because me and Andrew have a lot of fun together, and I think the kids really benefit from this kind of treatment.
Mm-hmm.
Yeah,